thank Dr. Zarowski and Steve Eisman for joining us for a question and answer. And I just want to thank all the participants for sending in such wonderful questions pre-webinar as well as on our live chat during this evening's webinar. I'm going to first ask a question, and I think that both Dr. Zarowski and Steve can probably answer this quite well. The question came in: how do you motivate yourself to do physical exercises, especially when tired? What else can I do besides exercise?
Steve, do you want to go first, or do you want me to go first?
Why don't I do a short response, which is to say, you do physical exercise. Don't look for reasons not to. Assuming things like your heart and those other things are being managed effectively so that you can do exercise safely. If the only thing holding you back is the impetus or what you perceive as the energy to do it, let that be your warning signal that you need help, and that help can come in the form of joining a group, pairing yourself up with somebody who you know to be motivated, and if you're looking up at a tall mountain and thinking, boy, that's too tall, I'm never gonna get up there, then don't look up, just look ahead and take the first step.
Yeah, that's awesome. I think that's a lot of exactly what I would say. Is exercise is unique in Parkinson's disease. It is the only thing that's been shown to slow down the illness. So the more you can do it, the better. Choose a time. Choose a time that you think is best. So a lot of people with Parkinson's disease have motor fluctuations and even motivational fluctuations. Sometimes they come with fatigue or energy. So there's usually a time of day that's best, and you have to be careful how you spend that time. But part of that time may be exercise. So choose a time when things are going well to initiate. Yes, partnering. Yes, doing it as a group and not with your partner, but doing it with someone outside the partnership you're committed to is important. Maintain a journal. Write it down. You did 5,000 steps. Awesome. Did 1,000 steps. Great. Did 10 steps. Great way to start. Ideally, if you are doing exercise that requires a change of clothes, change your clothes, put your sneakers on before you decide not to do it. Again, little steps count for a lot. Anything else? So the last thing would be, I think I mentioned in my presentation, is pay a trainer. Money is a motivator. You spend money on a trainer who's waiting for you. That's a motivator to have a buddy to do exercise with. So these are some of the strategies that I would recommend.
Great, thank you both. That was wonderful. Next question that came in was, how do I support my partner who is dealing with uncontrolled behavior, especially if he doesn't ask for help? How do I manage without supervising him around the clock?
So this can be a very difficult question. So clearly safety is very important. And if some of that behavior is endangering, let's say, driving a vehicle under the influence or unsafely, then you have a responsibility to contact the authorities to report this. If you think there's a danger to self or to someone else, then in Ontario, you can go to the Justice of the Peace and fill out a Form 2, which means that there is a mandatory psychiatric assessment through an emergency department. So those are some of the strategies that sometimes are necessary if the behavior is in the realm of dangerous. Now, if the behavior is something like gambling, it becomes much more tricky because the person with Parkinson's disease who's gambling excessively often knows what they're doing. They'll tell you, I have a house that's worth $400,000. I'm spending $100 a week. It's my money. What do you care? And there's actually very little recourse with this. The things you can do is have a discussion with the treating neurologist to say, okay, this is what I have observed. Is there anything we can do? Because sometimes the medications, as I've mentioned in the presentation, are a culprit. But then it's also very difficult at home. Like, as you say, and the question is, what do you do? Follow someone around to make sure they don't do something? How much risk are you willing to take? So, for instance, if the person walks and falls frequently but refuses to use a walker, is this a reason to follow them around and make your life tied to them and all the time nag to say you have to use a walker? Those are very difficult decisions because the concerns are significant. The consequences of a broken hip are severe. Limiting life, your life, the person with Parkinson's life, to always use a walker because of fear of breaking a hip, those are severe consequences as well. And figuring out your relationship to that is very tricky, and it bears discussion between the person, but perhaps if you are part of the same family, you and other members of the family, to try and find strategies and to remedy the situation.
Great, thank you so much. Next question is, how do I test dopamine levels in the brain?
So currently there's no test. Currently, dopamine levels for, let's say, Parkinson's disease, which has low dopamine levels, it's a clinical exam. The diagnosis is made clinically. Once you start exhibiting movement problems, then you've lost, I think it's 80% of the area of the brain that's producing dopamine. There is a test that people use usually in research settings, but it's not clinically necessary or accessible in Canada anyway. And I'm not sure how well it actually relates to dopamine levels per se.
Okay, thank you. The next question was, what is your experience using Ritalin?
I actually prescribe it a fair amount. I think it's a good medication for individuals who have Parkinson's disease. Some people cannot tolerate it, though. It's too stimulating. They get jittery, and that's sort of restless in an uncomfortable kind of way. But otherwise, it can provide useful energy, useful focus for motivating and for energy, which can also be, you saw in my neuropsychiatric symptoms related to Parkinson's disease, fatigue is one of them, and fatigue is one of the things that Ritalin methylphenidate treats. It's been used in some studies that show that individuals who fall because they're tired, if they take Ritalin, they can actually fall less frequently. So it's got its place. It is an addictive medication. It's a bit like a coffee, or actually a really super magnified coffee. So you have to be aware of that. And like any other medication, it cannot be used lightly, but it's got its place in terms of treating motivation, fatigue, and even depression.
Great. I know we had a few questions submitted asking about the use of cannabis or cannabinoid oils. Do you have anything to offer with that?
We don't know. We don't know what cannabinoids do yet. There are studies that are ongoing. Even at the Toronto Western Hospital, we're doing studies to try and ascertain what is it that they do, how safe are they. They may reduce anxiety or potentiate sleep, but it's hard to know. From the patients that I see, whom I talk with, who have tried cannabinoids, only a small percentage, maybe 20, maybe 10%, go on and use it on a regular basis because they find the cannabinoid useful. Obviously, don't smoke it. You don't need that problem. But it's hard to know as yet. Hopefully, there'll be more information that will be coming out in the next year.
The question was, what are some of the standard antidepressant meds that Dr. Zarowski was referring to?
So depression and Parkinson's disease respond to a variety of different antidepressants. And standard antidepressants can be what we call the SSRIs, which are the Prozac family, those kinds of medications. Paroxetine is the one that has the most difficulties for people with Parkinson's disease. It has the most likelihood of causing increased tremor, but it can also be useful for anxiety. But sertraline, fluoxetine, then there's other ones from other families like mirtazapine, which is sort of a related family of antidepressants that's commonly used, commonly prescribed by your family physician. Family physicians will often be very comfortable with the use of these medications for the treatment of anxiety and depression. And the catch with Parkinson's disease is that you just need much lower doses usually, especially to begin with. So something like sertraline, someone without Parkinson's usually needs about 100 milligrams to see a response. Somebody with Parkinson's disease may need 25 milligrams. So much different doses. But these medications can be very useful. And about 50% of people with Parkinson's disease are on an antidepressant or a benzodiazepine, which is a different group of medications for anxiety, but another one that treats mood. So common, useful treatment of depression and anxiety.
Wonderful. That was very helpful. Thank you. The next question was, does the effectiveness of the apathy medication tend to level off after a few years, like the usual PD cocktail?
Not so much in my experience. You start over time with these kinds of medications, there can be more fluctuations. So within a day, there will be a period of time that apathy and movement are treated, whereas other times where there's a dip. So that's more likely to happen. The other difficulty is with something like a dopamine agonist. As you get older, it's less the hyperactivity that people get, but more likely to have hallucinations. So this sort of side effect profile can change with age.
Okay, great. The next question was, should a person who thinks they are experiencing apathy seek out a referral to a psychiatrist?
It kind of depends where you live, actually, with that question. There are definitely psychiatrists like myself who are involved in the treatment of Parkinson's disease frequently and have gone to greater lengths to learn about the illness and how best to be helpful. That's not true everywhere. Psychiatrists are hard to come by in some places as well. I think the best place to begin is a neurologist, and many neurologists will know quite a bit about this illness and be aware of how apathy fits in and what to do about it. So I think that's the first step. Now, if that's not successful, then I think you would be looking for a psychiatrist or a neuropsychiatrist who would be familiar with the illness.
Wonderful. And our final question for you, Dr. Zarowski, can apathy be treated with deep brain stimulation?
So surgeries, it's actually usually the other way around, unfortunately. If not careful, deep brain stimulation can cause greater apathy depending on how the medications are changed after the surgery. So it's not that the surgery itself, I think, causes apathy. It's more about the medications and what we do, especially with the dopamine agonists after surgery, that is important. Because again, you're treating different areas of the brain. The surgery prioritizes movement. And if movement is prioritized, it needs less oral medication dopamine. But then the other part of the brain, the frontal part of the brain that also needs the dopamine, gets a less medication, less dopamine as well, and all of a sudden you become apathetic. So it's about balancing these different areas together with the stimulator and maintaining motivated activity, maintaining mood is what's important. And that's what having somebody who really knows what they're doing as they're setting the stimulation and modifying the medication is really important.
Wonderful. Thank you so much. Those were some excellent questions and some really wonderful answers. Our final question tonight, I think, will be for you, Steve. Someone asked where you ride, and maybe this is a great chance for you just to get into a little bit more detail about rigid riders.
Sure. Where I ride, independent of rigid riders, my travel is curtailed, but my last foreign excursion was riding in the mountains of Nepal. That was a year ago, and then a year prior to that through Sri Lanka, and then other Asian destinations, Thailand and Vietnam and Laos and things like that. With the rigid riders, we're based in Toronto, and we like to ride throughout the GTA. We go out to Milton, as far as Milton one way, and as far as Whitby the other way. We try to go north of the city, and our strategy is to use the so that we're being as, at least within the GTA, being as exhaustive as we can, include as many people as we can. We've been having some recent discussions with a maritime group that wants to start up, and we have resolved to lend any support that we can. There's things we've learned along the way about what works and what doesn't work, keeping in mind that you are dealing with very reluctant people. They are almost actively avoiding participating in these events, and it's only after the event that where they're so flush with pride and reward, and we really want to get people to that state, because if they the community effect of people gathering together and doing something other than talking about their medication or the problems that are associated with Parkinson's, and instead working towards doing something that's ultimately good for them, and looking at how they're going to solve their problems. If they have balance concerns, well, let's work with that. Let's see if it's just a fear of balance or if it's actual balance. And depending on the answer, we go one way or the other. But there's always an answer. We're really eager to hear from participants. We're setting up a website for the rigid riders, but in the meantime, we can be found at gorigidriders@gmail.com. And if not this group, find a group. And if not cycling, pick something else. And if you don't know what else, think about what you used to do and ask yourself why you're not doing it anymore. And if there's no good reason why you're not, get back at it.
That is some wonderful advice, Steve. And I'm just going to end off by, once the pandemic is over and travel is open again, do you have an idea of where you might be cycling next? What would be your next dream spot? Dare to dream. There's a
couple of places that we're looking at right now. We're thinking about Argentina. We're thinking about Israel and Morocco. And there is some crazy notion of going across Canada.
Wonderful. Doubt you'll get to probably all those places. And I look forward to following you on that journey. So I just want to thank you both so much for taking this extra time to answer these questions and just for your participation and your involvement. I think this was just a really wonderful webinar. So thank you both for all your contributions, and hopefully we'll be able to do something fun again soon.
Agreed.
Great. Thank you.
Thanks very much for having me.